So, common misconceptions about epidural. Me and my wife actually have these conversations in the car quite often. So I said, why don't you ask me the questions and I'll tell you if they're real or not. And we'll actually use her as a model to show different areas of the back if we need to, for those of you who've ever gotten an epidural or plan to get one in the future.
Okay. Can I become paralyzed if I move?
The short answer to that is no, but it's not impossible. When you're getting an epidural, for example, turn this way for me and hunch. Yep, hunch over like think of a shrimp, hunch over. So we don't want you to move. We're working in this area here, and you can see her spine really well here.
And do you hunch like this?
No, no.
Much?
You need your chin to go to your chest, and you need to hunch. I want you to think of a cat when they get scared. That's what I need from you. Yes.
That's what you tell them?
Yep. Hunch like a cat. Think of the letter C, or even like a shrimp.
So weird.
So this position here is where we want. Now, you can come back. If you move, it'll affect us, but it's not to the point where you'll become paralyzed. The only time you can become paralyzed is if, say, you were to just totally go back and almost lay flat on me and there's a needle there, that can make you paralyzed. That never happens. If you're hunched over, hunch over for me one more time. Now, make little movements say, ow, that hurts.
Ow,
You know, making little, that's tolerable. Now make big movements, like, no, you can't do that, you're done. You can't make big movements like that, and I'll actually be real clear about that when I start when I start to feel like you're starting to do that. I like to explain it real early and real often that this is gonna be quick. It should be painless, but there will be some moments where I sting you with anesthesia to numb the area, and there will be pressure. But it shouldn't be an unpleasant experience. If it's unpleasant, it's mostly just due to anxiety and nervousness. But for the most part, these are quick procedures, in, out, and then we get you very comfortable. The end result is way worth the few moments that you may have some pain or some pressure or some stinging. That's what I like to tell them. So paralyzed, it definitely can happen. It, just like like an asteroid can fall out of the earth, and it can happen. But the likelihood is very, very rare that you'll become paralyzed from an epidural in the OB setting.
Got it.
Mm-hmm.
Second one would be, is it easy for it not to work?
Yes and no. Again, a lot of times, one of the most common ones is actually patients say, I feel it on one side, I don't feel it on the other side. And what happens is sometimes the little catheter that we put into your epidural space, it can be migrated to one side, and the epidural only works if the entire circumference of the spine is being covered with the anesthesia. So if the catheter is on one side only, only one side works. Now, the easy way to fix that is the side it's not working on, we have you lay on that side because gravity will allow the medicine to go that way. Now, even if after that doesn't work, we can pull the catheter back a little bit and hope it becomes, instead of on unilateral, it becomes in the middle, which makes it bilateral.
Yeah.
Worst case scenario is, and it's rare, but it can happen, is we pull the whole thing out and just do another epidural.
Okay.
That doesn't happen often, but after you've tried all these other steps, that's one of the things you do. Yeah.
Okay.
Yeah.
My third one would be, is it going to hurt me? Because the needle's so big.
Right. So another common misconception is the needle that we use to actually find your epidural space is not the needle we actually use to numb you. So the needle we use, turn this way for me a little bit, one more time. We use
shrimp?
Show shrimp. We use a tiny needle, and it really honestly feels like a mosquito bite, to go initially into your space here and numb not just the skin, but even into where like the fat is and the muscles. You're good. And so we go in there and we numb it. The bigger needle that we use, you don't feel it. You may feel pressure, but you don't actually feel that big of a needle because you're numb. So once I numb you with the needle that's very small, that area is nice and numb, and you may feel pressure. And the best way I like to explain it to patients is,
it's like dentists.
It's like going to the dentist. Yeah. This is going to be sharp pain, like a pen pricking you. And I got ink on you. This is going to be pressure.
Yeah, the other side.
I can't take pressure away, but I can take pain away. That relates to your actual pregnancy and also what I'm doing back here. Yeah. Because when you're contracting and you have an epidural in, you're going to feel pressure, but you won't feel pain, especially when you're really complete and baby's coming. Anyway, to go back to what we're talking about back here, you're good, is that You're gonna feel an initial sting and pain from me poking you, but it goes away within 10 seconds, and then you're numb.
It's like a shot.
Yeah.
An arm shot.
Exactly.
Yeah.
Not even that bad. I think those are worse. And this is probably a good example of the size of a 2-way needle. That's what we use to actually go into the skin, but you don't feel it.
Yeah.
It goes in just like that, and it's about it's not this diameter. This is real thick, but it's about this size.
Like, yeah.
So
yeah, well, you can see it in the video.
Yeah, you don't feel any of that. You will feel a little pressure, and mostly you're just kind of anxious about it.
Is there any other questions people ask all the time? I feel like those
Those
be
are
my top
definitely
three.
the top 3. They say, will the epidural not work, or how? Or they think, how long will it work for? And the best way I like to explain it is an epidural is like an IV. If you have an IV in your arm, we can give you medicine all day long for as long as we want, because as long as the bag where the medicine's going in through the tube has stuff in it, it's going to keep flowing. That's how an epidural works. An epidural isn't just a one-shot deal and we're done, and it lasts 10, 12 hours. It lasts as long as it needs to last.
You can run it as long as you need.
You run it on a pump that pushes medicine into the epidural space over time. So you can never, there's not really a time limit per se.
Yeah.
Because if you don't have a baby within 24 to 48 hours, you're going to go to a C-section. And that happens often.
Yeah.
So it's not like you're going to be just sitting there in labor for more than 24 hours. Because at that point, we'll do a C-section. And that's a whole nother video to talk about how we do those kind of things.
And people have a clicker?
Button, yeah.
Like you can control it
Exactly. So there is a button that comes with it. And what it basically does, it just adds a little bit more medicine than what you're having. As you progress through labor, and when you get into that, 5th, 6th, 8th hour, you sometimes start to feel a little bit more. You push the button, and it'll only deliver an allowable amount. You can never overdose yourself. That's what I tell patients. But I do tell patients this: no one can touch that button except myself, you, or the nurse. Family likes to come in and see their daughter or their family member in pain, and they want to go click it for them. No, they can't do that. You get in trouble for that. So we make that clear when we're in there.
Cool.
Yeah.
I think those are all.
Yeah.
Misconceptions. Yeah.
Cool.